Hi, welcome to this webinar sent to you from Stockholm, Sweden. My name is Petra Tegman. I'm the CEO of Swedish Care International, which is an educational company based in Stockholm, Sweden. We have, during the last month, received so many questions from friends and partners from around the world asking us how the Swedish strategy on battling COVID-19 is affecting our elderly here in Sweden. So we will spend the next hour or so to try to answer some of your questions and explain a bit more about the situation that it has been in Sweden and the way that it is at the moment. Feel free that anytime during these hours, post any questions, just add a comment or a question, and we will try to pick it up and try to answer your questions along the way. As I mentioned, my name is Petra Tegman. I work as a CEO here. I'm also working as a nurse, Silvia nurse at the foundation Stiftelsen Silvia-hemmet, where I do a lot of training for nursing companies, doctors, home care centers, and family caregivers. I also take care and is responsible for a lot of the international relationships related to Silvia-hemmet. I'm a nurse by training. I have also a specialized degree in dementia care and also in palliative care. So I've been working in the field of elderly for more than 25 years here in Sweden. And my job this hour is not to either defend or condemn the Swedish way to approach this pandemic. I will only give you my perspective as a nurse and as a Swedish citizen to what has happened and what I believe has gone wrong, what we might have been able to do better, even though I think it will take approximately or probably a few more years to find out if our strategy has been working or not, or if any other country did better. What can we learn from this anyway? And the whole strategy here in Sweden is, we can say, is based on one word, and that is trust. In Sweden, we do have a lot of trust in our politicians, in our authorities, to each other. So the strategy is really based on personal responsibility, and the aim is to reach a herd immunity. Next slide, please. During this hour, we will talk a bit about Swedish Care International and Stiftelsen Silvia-hemmet, which I will present a bit more. I will give you an overview of Swedish history, very, very short, but to give you just an understanding of why we might be in the situation we are at the moment. We'll talk a bit about Swedish elderly care. I will give you COVID-19 timeline from Sweden and also show you some statistics. We will also give you some good example, impactful cases and initiatives that has been taking place. And I will also, in the end, share some of my personal story related to COVID when I got affected myself and what happened. And after that, some summary conclusions. Swedish Care International is an education company that is specialized in person-centered dementia and elderly care practice and methodology. It was founded as a response to the increased demand from foreign entities to transfer Swedish know-how in elderly and dementia care. And our vision is to make the world's best dementia care based on Stiftelsen Silvia-hemmet's care philosophy available worldwide, among other things. Next slide, please. The Stiftelsen Silvia Hemmet, the foundation, was initiated by Her Majesty Queen Silvia back in 1996 when she realized her mother was suffering from a dementia diagnosed. And she then found out that to be able to provide really good care for somebody living with dementia, you need a lot of knowledge. And back then in 1996, we didn't have a lot of training opportunities in Sweden when it came to dementia care. So Stiftelsen Silvia Hemmet, that was initiated in the mid-90s, started a training center in dementia care. Since then, we have trained thousands of people and more than 100 nursing homes here in Sweden to do better when it comes to dementia care, provide person-centered care with the aim to give our residents or the person living with dementia a better quality of life. Stiftelsen Silvia Hemmet also has a daycare center for people living with dementia. It is open 5 days a week, and they come and visit from their homes and travel by taxi to Stiftelsen Silvia Hemmet. And of course, we had to close down the daycare center when the pandemic hit Stockholm and Sweden back in March, but I will tell you a bit more about that later in the presentation. Next slide, please. Here at SCI, we're very proud to have a quite new e-learning program for caregivers developed, which is based on the Silvia Hemmet care philosophy. It's quite a comprehensive training that anybody could take if you are a caregiver for somebody living with dementia. You can find more on our website that we will show in the end if you would be interested in that. Next slide, please. We are also here at Swedish Care International. We have, you could say, 3 parts. It's the e-learning or the training part. We also have Dementia Forum X, which is the day of reflection and discussions among 100 of the world's leading business executives, policymakers, researchers, and other stakeholders. The event has been held biannually in Stockholm and in Tokyo, and it is also planned to take place in Seoul late in 2020. Next slide, please. We're also very proud to host the Queen Silvia Nursing Award, which is a scholarship for nursing students and practicing nurses in Sweden, Finland, Poland, Germany, and Lithuania. It was founded when Our Majesty Queen Silvia turned 17 in 2013. And the main ambition is to raise awareness in nursing as a profession and to generate innovative ideas in elderly care. Next slide, please. A very short summary as an overview, Sweden is not a country affected by war. We have not been occupied since 1520. For more than 200 years, it's been a country of peace. We were neutral during both First and Second World War. Many people blame us to be a bit naive since we are not war affected. We still have we don't have the readiness for a big pandemic or for a big crisis, as you could imagine a country would have, but unfortunately we didn't. For example, we have taken down all our stockpiles for PPE a couple of years ago, which has now, of course, been troublesome when this happened. So we have heard from other countries that we are a bit naive since we have not been war affected. But we're also a country that was the first one in 1766 to have the freedom of press written into our constitution. We have also very strong beliefs when it comes to equality and human rights here. For example, we have no right supporting to lock anyone in a nursing home in, for example. You cannot do that. We always have to have the equal rights and human rights that always comes first for our citizens, which is, of course, something we are very, very proud of. But it is also one of the main reasons that we were not able to have a lockdown in Sweden, because we don't have any laws that support us, the government, from locking in people. So that has been one of the issues or one of the discussions, that we didn't have anything to support that. And we're also a country that is protecting openness. We are a very transparent country with a lot of facts, a lot of statistics shown. You can find anything you want to find when it comes to, especially now during the pandemic. And as I mentioned in the beginning, we do have a lot of trust in our politicians and our authorities in how they are handling this crisis as well. Next slide, please. As an overview, Sweden is a country of a bit more than 10 million inhabitants, where most of us are living in Stockholm, 2.3 million. The capital is a large capital in the Nordic countries. We're also the largest country out of 4 in the Nordic countries. Our prime minister is named Stefan Löfven, and we have a welfare system that we are very, very proud of. And Sweden's entire citizens, so the whole population, has equal access to the public health system. And the healthcare system in Sweden is financed primarily through taxes levied by country councils and municipalities. So we have a long tradition of a well-functioning welfare system that is care for all the times. Next slide, please. The Swedish elderly care is developed through many, many years and is very well functioning, I must say. It is based on person-centered care, and it has now, during this epidemic, got a lot of undeserved criticism because it is a well-functioning and well-working, very well-developed elderly care that we have in Sweden. We have a care that is based on ensuring dignity and integrity. As I mentioned, it is affordable due to it's a social welfare system, and it's accessible for all our elderly. What we have is a very good and well-working combination of home care and institutional care. So if you want to stay at home, you can always do that for many years, for a long time during your first elderly part before you get too sick or need too much help or assistance. But you can get a lot of help in the environment of your own home. We both have governmental and private providers. There has been some unfair criticism against the private providers in Sweden at the moment, but those statistics are fortunately not right. There's not been any big differences between the governmental or the private providers. They are doing equal during this crisis. We have a lot of detailed registers to analyze the situation and the quality. And what has been shown through a lot of registrations is that the care that the elderly are getting in the nursing homes are somehow in some ways even better than the ones they're getting in the hospitals. And that is mainly because if you are staying in a nursing home, staff know you. They know what you want and what kind of care you would like and how you want somebody to take care of you. So they are able to do a lot for you in the both when you get, if you have been affected by COVID or if you are in your later stages of life, you will get really good support and good care. Next slide, please. So here is a short presentation of the corona timeline here in Sweden and the rest of the world. You can see in the picture there is our chief epidemiologist, Anders Tegnell, who was barely known to the Swedes back in the beginning of this year, but is now very well known. Everybody recognizes him. He works for the Public Health Agency, which is Folkhälsomyndigheten here in Sweden. When the crisis came to Sweden, the politicians here in Sweden turned all their trust and faith into our experts and have always looked for the experts to give them advice and in what way to handle the situation during the pandemic. But if we start from the beginning of the year, it was already back in January 5th when WHO published the first disease outbreak news of the new virus, the coronavirus. In the end of January, there was a lockdown in Wuhan, and the WHO declared that it was an international concern in the end of January. Actually, on the day after the 31st of January, we had our first case in Sweden. Back then, we didn't take it very seriously, so to say. We thought it was only some people coming in who had been traveling to risk areas, affected areas. But in like less than a month later, on February 21st, there was the first lockdown in Europe when northern Italy was closing down because they had been quite severely hit back then. On March 6th, the Folkhälsomyndigheten, Public Health Agency, declared a domestic contingency that we had a national spread of the virus here in Sweden. And on the 11th March, we had our first death in Sweden due to COVID-19. That was also the same day as the lockdown started in our neighbor country, Denmark. On the 14th of March, even Spain declared a lockdown. But on the 18th of March, one of the strongest measures that has been taken in Sweden was announced, and there was a decision to close down some schools from kids that are above 16 years of age, and to high schools, universities, and so on. They were all closed down and forced to do everything web-based or internet-based. On the 27th of March, we were not allowed to have gatherings more than 50 people in Sweden, and that is still the same number that we're allowed to gather. On the 1st of April, Folkhälsomyndigheten and the government declared some restrictions for visiting in nursing homes. There was no more people allowed to visit nursing homes. But to be honest, I don't know a single nursing home that had kept open at that point of time. Everybody had taken out their own decisions to close down way earlier, some even mid-March, and most of them at the same time as the school closed down. They realized that to be able to stop and minimize the risk of getting the virus into the nursing home, they wanted to stop the virus from spreading. Back then, we didn't, I think most of what we have been looking back at here in Sweden is that we didn't test enough back then. We had only, the first test we started was from the 13th of March. Up until then, we only tested people that had been in risk areas, risk countries, like in China, northern Italy. After the 13th of March, we started to test all the patients that were admitted to hospitals, and also a test patrol, a test troop went around to nursing homes to do tests on elderly care in nursing homes. Next slide, please. As I mentioned, the aim has always been to get a herd immunity, and we wanted to flatten the curve. We didn't want to have the orange curve. We wanted to see more of the blue curve, where the top of the curve is the number of hospital beds that we have here in Sweden. So we wanted to get below that, of course, and we actually have. It has been, the healthcare system has, what you can say, been one step ahead all the time. We have not had any crisis. It has been difficult. It has been very, very challenging for a lot of the nurses, mainly, who has been working a lot during these last 3 months. But we have not had a big crisis yet. We have always had available places, both in intensive care and in other hospital wards. So we are doing okay, and the Anders Tegnell from Folkhälsomyndigheten claims that we have been able to flatten the curve. We are below that number all the time, so that is a good way. Next slide, please. Before we knew what the situation was going to be, there was a governmental decision to open up the Nordic region's largest exhibition center, which is based just south of Stockholm. Together with the military, they built a whole hospital with 600 beds inside this exhibition unit. Fortunately, we have not had to use it. So it is now being started to take it down, because we cannot see the need of it in the near future, and hopefully we will all be right. Next slide, please. As I mentioned before, we are one of the only countries, one of the few countries in Europe with no lockdown, since we don't have any laws to support it, which is one of the reasons. But instead of that, it has been based on the personal responsibility and the trust for all the people living in Sweden to do whatever they can to stop spread the virus. Together we can slow down the infection. There has been a lot of recommendations printed in a lot of different languages to spread the information around Stockholm and around Sweden. And some of them are basic that is used like in every country, to stay at home, and even if you feel the slightest cold, wash your hands frequently with soap and water, use hand sanitizers if you have it, keep away from others, both indoors and outdoors, keep the social distance, avoid parties, funerals and weddings, do not travel in rush hour traffic, which is, all of these are still recommendations. And on today's press conference, they even said that you should try to only travel with trains or flights or whatever, where you can find or buy seated tickets. Don't go with buses or subways where there is a risk of people getting too close and not being able to keep the social distance. And only travel if necessary, of course. And still, if you are 70 years of age or older, it is especially important to avoid places where people gather. Pro and cons. Pro for this has been that we have not been locked in, which I think a lot of people see as a relief. We have always been able to go out shopping, go out for walks, do whatever, not really whatever we want to do, but there's been a lot of things we have been able to keep doing with responsibility, of course, but this has also given the opportunity for a lot of companies to still be open and still be able to earn some money. Some businesses have survived, but we unfortunately have a very high unemployment rate, higher than we have ever had. Some people believe that this will go on even for after summer, for the fall, and but others believe that the economy will catch up a bit after summer, where people can hopefully get back to work. Cons, of course, that there is so many people that have died. Every single person is, of course, a sad number, sad person, sad story. So I wish we could have done better, if we could have been able to have it some openly but get the numbers to stay lower than they had. But I'm not sure if we will see the full outcome until maybe next year or two, to see who did the best. Next slide, please. This is the statistics of how many cases we actually have that of people that do get the COVID or the coronavirus. We have just recently started testing, so that's why we can see the numbers are getting up, as you can see. They have started to divide them into mild or serious, where the ones that are serious are the ones that are in need of hospital, like medical attention, going to the hospital. The mild ones are the ones that get milder symptoms and can still stay at home. So in the beginning, as I mentioned, we only tested in the ones that came into nursing homes, or the ones living in nursing homes showing symptoms, or people that were admitted to hospitals. But now we are testing much more frequently since the last 2 weeks, which we can see on the next slide, or the slide after. Next slide, please. Yeah. These are the ones where you can see how many that are tested individuals, which was like the week before last week, week 24, it was over 60,000 people who were tested. And that's where we can see the numbers also are getting up for the ones that are affected by the virus. So we're getting more and more numbers, but hopefully we will not get more and more people getting severely sick and in need of medical attention. Next slide, please. This one shows the prevalence per age group. And the only thing we really knew before the pandemic came to Sweden was that the elderly were at the highest risk of getting it. Unfortunately, we were not able to protect them as good as we should have. You can see the red here is the elderly above the age of 80. And there was a lot of cases of the elderly getting affected, unfortunately. But the rates are going down, the numbers are going down. So hopefully we will go back into much lower prevalence now, especially among our elderly. Next slide, please. This one shows the dark pink, or whatever you should call that color, is the patients that has been admitted to the intensive care unit. That is also a number that is going down, fortunately. We had a peak where we had approximately 600 patients in the intensive care unit at the same time during around Sweden, but at the moment it is less than 200 that is in need of intensive care at the moment, which is good numbers. These are also the amount of the people that has been in need of intensive care treatment is one of the numbers that is the ones showing how severe we have been hit in the country, because as we said in previous pictures, a lot of patients doesn't barely show any symptoms or quite few symptoms and don't need medical attention, but the ones that need ICU care is the ones that of course is worst off, needing a lot of attention and a lot of care. So but the numbers are going down. As you can see, also the numbers of patients being in hospitals getting care at the moment are also going down, which is a very, very good sign, and we'll hope to keep it that way. The total numbers of patients that has been in the ICU is 2,354 in Sweden up at this time. And the next slide, please. The number of deceases weekly, here we can see also is going down. As of today, the number is 5,122 persons. And for the ones above 80, there has been death of 3,424, which means that more than half of the person that has actually died in Sweden out of COVID-19 are above 80 years of age. What we also can see is that 50% of the people that has died have all been living in nursing homes. And home care is very well developed in Sweden, as I mentioned in the beginning, which makes a lot of the elderly staying at home for a very long period of time. And a lot of them are actually even dying in their homes. But what happens is that when you have comorbidity, getting older and in need of a lot of more assistance, and you move into a nursing home, you're a lot of times, even before COVID came to Sweden, it was more the really elderly and with severe diseases that moved into a nursing home. So they already had a significant shorter period of their life left when they moved into the nursing home. We have quite recent numbers before COVID came to Sweden that 50% out of the people moving into a nursing home die within the first year. So they are in the later stages of their life moving into a nursing home. And we believe that they are very, very sick. They're very, very weak. And COVID-19 is a very severe virus infection that is difficult to handle. And that's why there's so many of the elderly that unfortunately has died due to this virus, and especially in the nursing homes. Next slide, please. This is a picture to show you a bit of what the differences has been in the country. The dark red spot is where Stockholm is, where we also had most of the cases. Most of the deaths has been in Sweden. We can now see that it is spreading more and more during the country. It has There are some new cases during this last weekend way up north in Sweden, in Västernorrland, where they're more and more getting affected. So it will be quite interesting to follow, and hopefully they will get the numbers down really quick, so there won't be a lot of more death, and especially they will be more prepared in the nursing homes than we were in Stockholm when we came here. Next slide, please. This is one of the instructions that has been translated to many different languages, since Sweden is a country where we have taken a lot of refugees for the last 5 to 6 years from many different countries with a lot of different languages. So these are possible to find online in various different languages translated to Arabic, Somalia, several. This is just an example in English to show that you need to wash your hands frequently, cough and sneeze into your elbow, avoid touching your eyes and nose and mouth, and of course, the most important, to stay at home when you feel unwell. Next slide, please. As I mentioned in the beginning, the Swedish elderly care is quite well developed. We have many years of a good tradition and good reputation of very well functioning elderly care. But of course, as in many other countries, we were not prepared for this pandemic. This really came in hard, and unfortunately, we were not able to protect our elderly well enough, I would say. We have a very high quality and person-centered care with a lot of important elements of teamwork, dignity, and respect that has always been an important part of the elderly care here in Sweden. But when the virus hit it, some of the changes and some of the governmental actions related to COVID were challenging for the Swedish elderly care. The staff did what they could with what they have, for sure, and did all the best they could, but the national strategy, where the virus was spreading really fast in Sweden, made it more difficult to stop it from getting into a nursing home. And we also could see in the beginning, one of the strategies was unfortunately that there was a shortage of personal protection equipment, the PPEs. Quite early, the government asked the municipalities, which are in charge of the elderly care, not to order PPEs, but let all the equipment go to mainly, and first of all, to the hospitals. In some regions, the second one getting all the PPEs were actually the police. And then third came the elderly care, which has been very unfortunate. So a lot of nursing homes are blaming the shortage of PPEs, first of all, for getting into the nursing home, for the virus to get into the nursing home, and for spreading. Also, one of the really big challenges was the shortage of personnel. Since you were asked to stay at home as soon as you felt any kind of symptoms at all, there was a shortage of personnel, obviously. And they tried to get a lot of hands and hearts to work in all the nursing homes everywhere. And in some parts, we have seen that there has been a lack of knowledge in hygiene protocols, which has also made it difficult for not spreading and stopping the virus. The no visit restriction, of course, has been very challenging for both family members and the residents themselves. We have seen a lot of people getting very lonely, of course, very, very, very worried as family caregivers or family members. But it has been important to keep it that way to try to stop the virus from getting into to the nursing homes. A lot of the positive or the good changes that has happened is that all the nursing homes have tried to provide with a lot more strict hygiene routines. Also, a lot of training of the staff, How do we work on isolating the ones that are infected and keep them from getting in contact with the other ones, the other residents or each other? And also one of the things that has been working out really well in Sweden, I think we have put a lot of more focus on good palliative care. How can we provide best kind of quality of life in the later stages of life when the elderly are already quite severe sick, living in nursing homes and need a lot of assistance? How can we give you the best kind of quality of life even in the later stages? But that has been a lot of discussions about that, and I think we have improved a lot of things even related to this in Sweden. One of the challenges has also been that Sweden's nursing homes are often built more like homes and not like hospitals, which has made it difficult to isolate patients in the rooms. And also, of course, difficulty in explaining new rules, new routines to our patients, either if you are, especially I would say if you have a cognitive disability, but anyway, it is difficult to understand why I cannot move around the way I've been used to, why can I not go out the way I want to, or why cannot my family members come here? It has been difficult to understand, of course. Next slide, please. At Stiftelsen Silvia Hammarlund, as I mentioned, is a daycare center. We have people with cognitive disabilities coming in every day between 9 and 3. Some of our guests come in for 1 day a week. Some come in for 5 days a week. What we do is just mainly to socialize, hang around, do things that you like to do, what you think is good for you, what makes you happy. And unfortunately, we had to close down in mid-March, mainly because our guests are coming to us by taxi, and we were not sure about the status of the taxi drivers, if they were well enough, healthy enough to drive our guests. So we decided to have the residents stay at home, and instead we went by our own cars home to the guests' home and took them for walks in their neighborhood, in their areas, of course, with a social distance. But in the end of April, we realized that our residents were not doing well. They were getting lonely and more worried, and they did not like the social isolation that was happening when they were staying at home. So we decided to open up carefully on May 4th with a lot of new routines, of course, like washing of hands, using hand sanitizers, trying to keep a social distance a lot, and also to try to stay outdoor as much as possible. But what we could see was that in the beginning, the first days, they were not doing well. It was good for us to open up. It took a few days for them to go back into the normal a state of life, more happiness. They were quite sad and affected by staying at home and not being in their social environment and being at the daycare center. So opening up was a good decision, and fingers crossed, there are still no one affected of the guests that are coming to the daycare daily. Next slide, please. We have had some really good initiatives taking place here in Sweden. In the beginning of March, or in late March, beginning of April, there were thousands of volunteers signing up to help at hospitals, doing whatever they can, just wanting to be hands and hearts available. There were services for the elderly above 70 plus, going shopping, grocery shopping, buying things for them, whatever they needed. Giving out a helping hand. There was a lot of really inspiring initiatives going on. So that was a positive thing, that we were coming together and helping out each other. Next slide, please. One of the other very impactful cases and initiatives that happened was that SES stopped flying, and Sophia University, which is one of our big nursing universities here in Stockholm, straight away started new training, a 3-day training course for the flight attendants to become nursing as assistants, trying to help out in the both hospitals and in elderly care homes. And one of the ones that actually took the course was our Royal Highness Princess Sophia. You can see in the picture in the bottom. She is married to the King and Queen's son, Carl Philip, who is the prince here in Sweden. And she went out working in a hospital. She took the 3-day course and went out to work in the hospital. So she really stepped up, and she has really showed us how much good things you can make out of this without having any knowledge before. So she is a good example. Next slide, please. There's also been a lot of different ideas, innovative ideas that came out of this. You can see the top pictures there is to ensuring safe meeting places for elderly and their family members, both digital meetings, but now when the weather is getting warmer in Sweden, there has been more initiatives to let the family members meet the residents outdoor. And this is a picture of having fika on each side of a glass window, drinking coffee together, sitting and talking. No touching, obviously, but you can at least see each other, which has made it so much more easy for both, of course, family members and also the residents in the nursing home. There's also been a lot of initiatives with live music performances outside nursing homes, outside hospitals, just to spread some good positive vibes in the area, which has been really nice to see. Next slide, please. And also many, many more. We want to highlight this, of course, from Swedish Care International's perspective. We want to identify and recognize more innovative ideas and solutions in healthcare. And therefore, we have set up this year's Queen Silvia Nursing Award as a COVID-19 main theme in both Sweden, Finland, Poland, Germany, and Lithuania. So we will try to lift the best nursing student or nurse's idea that came COVID related with a good idea, a good innovative idea. So that is coming up for the next year. Really looking forward to it. There's been a lot of course, sad stories happening, but we need to also try to focus on what was the good part, what good came out of this. Next slide, please. Very shortly, I would just share my own story when everything stopped here in Stockholm, and our training sessions from Silvia Hemmet, and also a lot of our meetings stopped here at Swedish Care International. I was asked to go back to a nursing home and work as a nurse. I was looking after 6 elderly patients with COVID-19 confirmed. We had a lack of PPEs, shortage of PPEs, and unfortunately I got sick myself a few days later. I got some flu symptoms. I got better, but then I get really sick again. I get worse again. And on the 14th of April, I was tested positive for COVID-19 myself. I managed to stay at home and take care of myself, but I really get to see close-handed the difficult symptoms that you can have out of this. I'm grateful, though, for having the antibodies at the moment, so hoping that they will stay for long, but of course no one knows. But it was a terrible story in the beginning. It was early in the beginning of April, obviously, where we didn't have enough PPEs because the government were not providing the nursing homes with equipment. So it was a difficult, challenging times. Next slide, please. So what have we learned? What lessons can be learned from this pandemic? Well, we don't learn from our experience if we don't reflect on them. I think one of the outcomes will be that we should have tested more and we should have tested earlier. We have also realized that the lack of PPEs has been a major problem. It's been one of the most difficult things to provide really good care, mainly in the nursing homes and in the home care sections. The main focus was on hospitals in the first stages, and some regions even the police came first. So there's been a lot of discussions, and I think we will learn from that if we get a new pandemic, or what could we have done better, it was to provide better care for the elderly early and to share the PPEs. Nursing homes are unfortunately not built as hospitals, as I mentioned earlier, which has made it quite difficult. And we have in nursing homes many people living with dementia. And that is also one of the most challenging times, I think. One of the most challenging things is to be able to provide good care for somebody with dementia who doesn't, and obviously they don't understand new routines, new restrictions, and also due to the lack of brain capacity, sometimes they don't even show the symptoms. They might not even get a temperature change in their body. And it's difficult for them also to say that I have a sore throat, I'm not feeling well, something in my body. So it might be difficult to detect when the patient or the person living with dementia actually had any symptoms. Also, we have a professor here in Sweden who has claimed dementia to be one of the risk factors of getting COVID-19 due to the decline of the brain capacity, of course. We have also noticed that employment conditions need to be updated. We need to talk more about how can we provide good employment systems for our staff working to make sure that they are well looked after, and the conditions in general has been a discussion here in Sweden. Also, we have talked a lot about the elderly care needs adaptations in some ways, and not in the care sector as much as it is in related to governmental level of how to provide the best kind of support for the elderly care. So that is also a discussion that is taken on. And obviously a lot of knowledge. What we have learned is that we need a lot more knowledge for the people working in the elderly care field, a lot of knowledge on how to provide good care, how to provide good hygiene standards, and also how to provide best kind of quality of care for the patient we have living with dementia. Let's see if we have any questions. We got some from Sherry here. Is the case number of 80 plus going down because of better protection in place? What you do see as the reason that the red line is going down lately? I believe so. We have taken on a lot more better measures, a lot of more knowledge about how the virus is spreading. There is not a lack of PPEs anymore. We know more about how to protect the elderly. So I would definitely say so. There has been much more measurements taken to protect them, which is good. Simona is asking a question here. Were foreigners living in Sweden more affected by COVID-19? Yes, they were. Unfortunately, they were. We can see a lot of numbers really quite high. Also, there has been a discussion going on. Sweden is one of the Nordic countries, or the one of the Nordic countries that has taken on a lot of more refugees in the last 5 years. And we can unfortunately see that a lot of the elderly coming from different countries and other countries than Sweden have unfortunately passed away during this time. And that is also one of the comments why the number is higher in Sweden, number of deaths is higher than Sweden compared to Finland, Norway, Denmark, who is not as many foreigners living in Sweden as we have. But that is also one thing that I think we really need to look back to and look into why did their numbers raise, unfortunately enough. Anna Kritz, how can we support mental well-being for all the people during this time, given that they have been cut off from their regular activities and social engagement? Very good question. And I think we don't know all the right answers to that yet. We have been trying. There has been, as I mentioned, a lot of really good examples of how to interact with all different kind of Zoom meetings, Skype meetings, team meetings, and try to make sure that families can still connect with their relatives, but also there has been a lot of different volunteers trying to connect with elderly who has been feeling lonely. But I don't think that we will see the total outcome of the loneliness in months. But I think it is devastating. It is the only thing we can see that it is really devastating. And I unfortunately don't have a good answer, but as I mentioned, we will have the COVID-19 theme for the Queen Silvia Nursing Award, and hopefully I think these are some of the great examples and great solutions that I hope we will find. As Skype meetings, social meetings, and activities online has been really, really good examples, but there's also been a difficulty for people with cognitive disabilities to use Zoom or Skype because it's difficult to understand these kind of meetings that we're doing. So good question, and it is one of the biggest problem, I believe, that the loneliness and people staying by themselves. Steve, thank you very much. Person-centered care is of course the main focus. As I mentioned, there has been a lot of focus on the palliative care perspective. And I think that is very well developed, getting more and more developed here in Sweden. And that is like one of the most person-centered care issues I think we need to focus more on also. It has also always been a topic in Sweden, but especially during these difficult times. How can we help everyone individually? In what way do you want to be helped, and how can we help you? Great presentation. Has your opinion about COVID-19 changed after you have infected yourself? Yes and no. I think I was quite prepared before. It changed a bit when I have seen elderly with flu like almost every year for the last 25 years working with the elderly. But this was definitely something different, especially with the coughing and the difficulties in breathing. It was challenging not to be able to work the way you used to do, since you didn't have any PPE, but we were a few nurses and assistant nurses who did anyway, and of course, unfortunately, we turned out sick. But in some ways, yes and no. It is a very difficult virus. You don't want to have it yourself, but we need to have respect for it. Definitely need to have a lot of respect. Yes. Daniela Gomez, here at the SBA, group activities are not allowed, so our team is doing cognitive activities with demented elderly using tips on how to do it in an individualized way, but within a large project, and then we show them the result. We're all using technology to bring people together. We all, like to know what is being done in Sweden according to Silvia Hammarlund philosophy. Yeah, as I mentioned, this is a difficulty for the people with dementia, and especially also in Sweden, we don't have a tradition of using PPEs. A lot of our elderly have never tried a mouth protection on it. Compared to many other Asian countries, that is very usual. You use mouth protection all the time. So this has also been very challenging for both the residents living with dementia, and also when you're a caregiver coming into the patient with a mouth protection, you look very difficult and unfamiliar. So it's been, of course, very challenging. But this, related to Silvia Hammarlund philosophy, I would definitely say the person-centered care perspective. Try to find out in the team together, what did the person like to do? It could be the simplest thing. What kind of music did he like to listen to? Can you, as a caregiver, sit down and listen to that kind of music with the resident? Watch photos. Is there anything you can watch together, like on a TV screen or something? The technology is, of course, useful, but also very difficult if you have a cognitive disability. And I think I've seen a lot of different really good examples from different parts of the world where it has been working. But as I mentioned, we are in Sweden, the ones living in the nursing home are in the later stages of life, and they're quite severe with dementia. So it is very difficult to use new technology. But here it is, once again, person-centered care. And music, walks. I know you have a really nice area around your nursing home. Can you sit out one-on-one or go for walks? Also group activities outdoor, is that a possibility where they don't have to sit too close to each other, but you can still play music like the examples that I mentioned previously, where there has been music outside the nursing home, so the residents have been sitting on balconies or in their window just listening. Try to think in a bigger perspective. If I come up with something else, I will let you know, Danielle. I cannot see if there was any other comment. Do you have pulse oximeters at the elderly care home? Yes, we do. We do. That was one of the equipment tools. Not all of the nursing home used to have it, but that was one of the equipments that were sold out really quick. Fever temperature meters and pulse oximeters. But pulse oximeter is one of the really good measurements to make sure you take in your residents, to make sure that what I have seen also with this virus is that the patient can actually appear to be doing quite okay, but the oxygen level is dropping, going down, and we really need to keep track on that. So pulse oximeter is very good and a handy way to get together with frequently making sure the temperature status for the patient and also the pulse oximeter. So I think that is a really good thing to keep, even in a nursing home. Thank you. I don't know if there was any other question. Did I miss any? No. You can always find our contacts at sei.se, and if there is anything you would like to know more about, don't hesitate to contact us again. I do hope you all stay safe and healthy during this difficult, challenging time, and cross our fingers that this pandemic will leave us sooner rather than later, and we find a vaccine or a cure or whatever, so there won't be a lot more people getting affected anymore. So stay safe and healthy, all of you, and thank you all for being here during this hour. Bye bye.